I would venture to guess that not many people have been discharged from the main office because they didn't need your services anymore. Like, I have a feeling that doesn't happen very often.
Can I just say, not
So,
many people are voluntarily discharged from a chronic
yeah.
pain doctor's office,
Like, I
right?
understand being discharged for some reasons, but like being discharged because you got better, like they do in the hospital setting, like you're discharged because you got better.
Yeah.
I
Yeah.
would venture to guess that doesn't happen very often.
It's easy to
And-
standardize the hospital and not
right.
Yeah.
Versus,
people.
Yeah.
we'll get into this here in a little bit, but I know you were talking about, how as an MA, you don't always have a lot of time to learn that history about each individual person, right? Do you, I don't know if you could tell, but I try to make it a point that you remember me, right?
Yes.
Is that a bad thing, or is that, I mean, I don't try to be an ass so you remember me. Let's put it that way.
We could say
Good way to
that on
remember
here.
you.
Yeah.
That's
Yeah.
valid?
You can say whatever you
Oh, are we
want.
on YouTube?
Yeah, and we're not on YouTube yet, so yeah, we can say whatever we want.
Oh yeah.
So-
Okay. Yeah. I didn't know. Okay. Awesome.
Let it fly.
At least I don't think we're on YouTube yet. No, we're not.
Nah,
So
we're working on it.
But I mean, I don't want to be a jerk for you to remember me because of that. I mean, I want to try to have you remember me and he made me laugh, or this dude's really is a messed up case, or something like that. Is that a good thing, or is that
listen, this guy in office number 2 or room number 2, he's real messed up.
He's
All
a
right,
messed
when
up
you
case.
go see him.
We like when you talk to us. We like when you say, "Hey, how's your day?" It's in before I meant it's hard to learn people's life as a scribe because of the the extended medical history.
Right.
But as your MA, I'd love to learn you. And now that I'm, getting in the hang of it, I do learn people. I've learned faces. I know people's names. Like I don't need this sheet of paper to know who you are. I know what you're probably gonna, complain about this time, or I know what you probably changed. It's easy in the clinic setting to learn you. It's hard when you're jumping into a bunch of paper.
Gotcha.
It's kind of
Gotcha.
So, yes. Talk to your care team. Talk to the front desk. Talk to your MA. It's important. We want to know you. Because I mean, if you're nice to me, if you talk to me and you're like, "Hey, how's your day?" I'm like, "Oh my gosh, I can kind of breathe for a second," Because I'm just like, okay, I gotta go. I gotta go.
I think we need to put a qualifier on it. Just because you're extremely nice to the MA or you bring them chocolates or roses, that does not mean you're going to get a shit ton more pain meds prescribed to you. Okay. You cannot bribe your MA. I'm just going to put that out there. So don't try that. All right.
Even though I love
you
chocolate.
can bribe them. You may not get anything, though.
I mean, look past the fact that Evie is driving a brand new Porsche. Okay. Look past that part. All right.
Hey, I'll let you skip the weigh in if you get the chocolate.
The weigh in.
There you go.
I suddenly go from 215 every time I come in down to 198. So I make my BMI for the first time in history. Right. It's like the running gag for me when you guys are checking me in back there. It's like you hook up that little computer blood pressure machine, and am I going to blow it up today or not? It is really how it works out, because it's like it's like the game. I think another aspect that a lot of patients miss out on when they're dealing with you or the person at the front desk, but especially the MA when you're back there, because you're actually in the exam room with us, is the person that's taking those vitals could also be an invisible in their own way, right? And I think if we keep that in the back of our mind, because I think as an invisible, we see patients different, and I think there's an instantaneous connection, right? And I think you can relate to invisible community in your own specific ways, right? And I think if we give that as an option in the back of our head when we're talking with our entire care team, I think that might be another way that we can kind of take down some of the walls and some of the barriers, right? Or am I wrong?
No,
I don't want
no,
to be talking out of
Yeah.
turn, you know.
no. You know, we're people too.
Yeah,
And, a lot of the time we understand, some of the things you're feeling. Because, I mean, when we go home, we also have to take our anxiety medication. We got to
yeah,
take our sleep medication to go to bed.
Mhm.
We got to
yeah,
wake up, oh, pop my Prozac and get ready for the day, you know?
yeah,
Because,
yeah, oh, yeah, yeah.
it's
Mhm.
just,
Because that's the whole thing with invisible, right? It's not external. Nobody can see it, and
Mhm.
it goes back to what I said at the beginning. You know, we need to be able to give the grace that we want to receive, and
Yeah.
I think for me, it's easier to give grace if I put in the back of my head, hey, maybe this person's fighting some stuff today, you know, or they're fighting their own invisible stuff, you know.
Yeah.
I think is
Yeah.
is an important thing. Um, I want to one of the reasons I wanted to have you on here so much and talk to you is because, like I said at the beginning too, to me, communication with our care team is vital. It is vital. I feel that we get
Mhm.
a lot more accomplished. What's the old saying? You attract more with honey than, you know, whatever, you
you
know,
get more
Oh,
because
flies
yeah.
with honey than
That's true.
vinegar.
yeah,
Yeah.
right. And
Absolutely.
I think people have a better understanding of you as a patient if we can take down that wall some. But I understand as a patient who deals with medical PTSD, it's very, very, very difficult at times because we've been burned so much and we've been harmed,
Yeah.
right, by other care teams. Um, I don't think you like this question, and I know people in the community don't like it when I phrase it this way,
Oh boy.
but I think
Hold on.
I think a lot of our anxiety coming to appointments deals with the previous PTSD. I think we have
Yeah.
to accept it and acknowledge it that we have it, which I don't think is a problem. I think we all, when we're dealing with it, we realize what's going on, right? But
Yeah.
how can we? I guess the question I have that I really want to delve into for as much time as we can tonight, how can we be better patients, right?
Mhm.
And I know y'all don't be mad at me for asking that question, but I think if we approach it that way, how can I be better? I think that opens our brain up and our and how we face things in a more fair way. It's not what can this
Mhm.
person do better so I can get better care, right? Which is a lot of people
Yeah.
address it that way.
Well, and I think addressing it that way and saying like, what can I do to get better? Like you're taking ownership of your health and you're taking ownership of your plan or your program, and you're not just leaving it up to the doctor or the MA or whatever. I know we've talked about this before about like you have to take ownership of your health. Like you can't just leave it up to other people to figure things out or to move along. Like you have to take ownership. And I think starting with how can I be a better patient is probably one of the first things I think you need to start with along that road, because I think it makes a big
Yeah,
difference.
but it's so tough because
So never said it was easy. Never said it was easy.
we've been burned, right?
Yeah.
And so so
Yeah.
as the person who I'm not a big fan of the gatekeeper term for you and your role, but I think it's applicable in certain ways. What besides not walking in and making a memorable impression on you by being a jerk, um, what are some just things that make your job easier when dealing with us? I guess would be a good place to start.
Um, um, I mean, just really, it's first, which I didn't even think about this before the live, is coming in and despite, you know, the what you have going on, not to say to disregard it, but it's good to have or try to have a positive attitude about things. Not
Mhm.
to say you have to just be peachy cream all the time. I understand you're in pain. I understand, sometimes, you have to wait in the waiting room too long. And I'm trying my
Mhm.
best.
Mhm.
I know
Well,
that
it's not always
it's,
you. It's not
yeah.
always you. It's
Yeah, I would
Sometimes it's
say.
raining outside. Sometimes, something happened before you came in.
Yeah.
I understand life is happening around you. And but it's good to have
Mm-hmm.
a positive outlook, even if you're faking it till you make it, because people don't realize how deeply like effective positivity is for
Yeah.
for healing.
Hmm.
That can
Oh,
completely
I'm gonna hold on.
change.
I'm gonna add something in there real quick because this literally just happened to me the other day. I went to go get an infusion last week, and I'm talking with the nurse, like she's getting everything set up, and she's talking with me, and she was asking me about the medication and my symptoms and all these things. And she goes, I just have to say, you are the nicest migraine patient I've ever met. And I was like, oh, thanks. And like she kept going. And then at the very end, she goes, no, I'm serious. Like, you are the most pleasant migraine patient we have ever had. And you are in so much pain right now. And you're being so nice. And I said, well, yeah, it's not your fault that I'm in pain. Like, why would I be mean to you? It's not your fault. And she was
Yeah.
like, can you tell everybody that? And I'm not kidding you. This woman came in and brought me a blanket, a Diet Coke, 2 snacks.
Diet
And
Coke.
on the way out, she gave me a bottle of water. Like, she was overly nice to me just because I was nice to her. It's like, it goes a long way. And honestly, like, I'm a big preacher of being nice and all the grateful stuff. But it's like, you're allowed to be mad and be in a grumpy mood and be bitchy because you're in pain, but don't project that on the people who are trying to help you.
Yeah.
And it's just the fact that she was like, I
Yeah.
wasn't being overly nice. I was just being nice. And that was just like shocking to her. It was kind of sad, honestly, but I got a bunch of snacks. So it was a win for me.
Well, I mean, but it boils down to, and Evelyn, if I'm wrong, correct me. My time with you is even less amount of time I'm going to get with the doc or the PA, typically, right? I mean, 3 to 5 minutes, right?
Yeah.
And so, but I think that 3 to 5 minutes can help set the tone for when we get in, when the doc or the PA comes into the room, right? And again, this is just stuff that I've experienced, and whether personally or people have told me. I've shared with you and other MAs, what's going on in this home right now with other illnesses and other things that are going on, to why maybe my meds aren't working. I'll be like, I don't know what the hell's going on. My meds have been doing okay, but this last month or so, I'm not getting any kind of benefit. Or, this PT plan, I'm not seeing anything yet. And my plan is to bring that up with the doc, right? But a lot of times I'll get too stressed out because that anxiety's back in my head, right? That I'll forget it.
Forget.
So would that be something that you would say to try to do, is to try to get some of that kind of stuff out to you in case we do forget it at a later point?
Yes.
Does that make sense?
Yes. If you have something that you want the doctor to know and that you're worried about that it's gonna get forgotten, tell me. Because when I am talking to you, because usually I go in, I say, go get on the scale, Keith, and then and then I make you go into the room, and then we hook you up with all the machines, and I'm asking all these questions. I say, what's your pain at? Any changes? That's the time where I'm like, okay, yes, I had this concern about this medicine, and I changed this with my other doctor, and actually, I want to talk about this with Dr. Leek, or just talk to me, because honestly, this is the time. This is like triage. This is what I do. This
Right.
is the moment. So a lot of the times, if you tell me, hey, I had this, there's a concern for this, and I had this new medication change, and I just been feeling really down lately, and whatever, and then I leave, I'll put in your vitals, and then when Dr. Lee comes by, or your doctor, or whoever comes by, I'll be like, okay, so this happened, new medicine, they've been feeling down, honestly, I think this may be good, or said they're really allergic to a lot of things, let's try some immunotherapy, or I've noticed this, how about maybe you should talk about this with them, and then when they go in, they can go straight to the stuff you're concerned about, because they know.
Yeah.
Now they know. And
That's perfect.
I people don't realize, because I'm I'm just, dump on me. If anything, dump on me and then get straight to the point with him.
I wouldn't call it dumping on you, but I
Yeah.
think maybe dumping on you in a polite way,
Yeah,
right?
yes.
You know,
Yeah.
because
Yeah.
to me that's that time that we get with you. A lot of times, I'm more comfortable sharing with you whether the meds are working or not, because I don't want to have the doc get the impression, if I'm complaining to him that the meds are working, that I'm not grateful for what I'm getting. Does that make sense? But for you, I feel more comfortable saying, man, these meds this last month, they're just not, we're missing the mark. Something's not right. It's easier for me to share that with you than to the guy that's doing his best to help me get a better quality of life. And I know that's a really twisted way to look at it, but that's how my ADHD undiagnosed spectrum brain works, right? Is I see they call it white coat anxiety for a reason, because they have a position, as much as I love Dr. Leek, of authority, right? Of education way above mine, right? And so I get nervous, and I feel more comfortable bringing that up. But I understand for a lot of patients that can be very difficult because of our PTSD, because of where we've some of the experiences we've survived. But I think it takes a conscious effort. I mean, Amy,
Yeah, no, and I was going to say that, like, it takes the effort to do that. And the thing that I love so much about having you on tonight and like hearing you say, like, yes, tell me everything that's going on, because I'm going to then go to him, is because I think, and I don't think I'm alone in this, so everybody in the chat, let me know. But I think for so long, I was kind of under the impression of, if I told the MA or the person who came in first, if I told them everything that was going on, I was then just repeating everything back to the doc because they weren't communicating. And it's like, I don't want to tell this story twice. So I'm just not going to tell them anything. And then when the doctor comes in, I'm going to tell him everything.
Yes.
And I think that may also just kind of depend on some of the doctor's offices as well. But even just like hearing advice from other people, that was kind of the advice I was given early on in my journey. And I've learned from doctor's offices not to do that. But it's still something, like, if I get anxious, I'm like, oh yeah, I'm going to tell them what's going on and do that. And so I think sometimes, I don't know, I think some people may feel like, oh, we're just telling the story twice and they're not actually doing anything.
And I understand that. And then yes, it definitely can depend on the doctor's office, but in this case, and when you talk, I'm not saying you have to unload everything in great detail. If you want to hold things, but it's better if you're anxious. I am the person that you get that out with. We're here for you. I'm here for you to get your vitals, to talk to you, to see what's happening. So if you need to talk about things, this is where it happens. Because also sometimes I have problems I can fix before he comes in, right? I have things I can bring to you and solve before he doesn't even have to know you need that, right? He didn't even. Those are solutions I can do in like split second, and that saves you time and him time. So then you can get straight to the stuff that he can solve.
Yeah.
Yeah.
I didn't even think about that. That's absolutely true. Yeah.
Yeah. So I want patients to think, like, not to say that you need to be. I know the fear is strong, and you should be cautious, but hopeful, right? And really, the MA should be, the people you meet first should be for you. We're for you, and
well, I think MAs, for the most part, are. I mean, I think there's, like I said, there's bad doctors, so there's going to be bad MAs. There's bad patients, right? But I think for the most part, MAs aren't going to go to work every Monday if they truly hate what they're doing, right? I think we need to give them the number one, respect, and number two, use that time as an opportunity to
Mm-hmm.
get some things across. And Jamie put down in the comments on TikTok that she will write stuff down. You know,
Yeah.
I used to be famous for bringing a note card in me I used to carry a notebook with me to every appointment. Now
Yeah.
I'll put it in like a note or an AI note on my phone or something like that. You know, so yeah. But I still forget that
Oh,
kind
you're
of
so
stuff.
fancy.
You know, that's because I'm lazy. You know, that's I don't do anything. I don't, one of my dogs taught me a long time ago. One of my favorite dogs of all time, Max. I learned from Max that Max taught me to be able to be successful with the least amount of work involved, and that's what
I love that.
Yeah.
you know, the least amount of
Work
energy I have to put
smarter, not
forth.
harder.
That is exactly
Yeah.
it, right?
Yeah.
But I think the time
Yeah.
with the MA is important. I think the time that we can bring some things up. Again, I think a lot of the times maybe it may not be different information, but it's presented in a different way to an MA. For me, I know it's presented in a more relaxed way for some
Yeah.
reason. You know, I don't get as hypertension, as hyped up about it. And I think towards the white coat anxiety part of it, if we not every office we're not going to see the MA the same one every time, but if we can build certain relationships across the board, right, and get ourselves trained, that the like once we get there and we get into the exam room, that things can start calming down because of the interaction with the MA. I think
Yeah.
that could be a first good step to help reducing the anxiety across the board. Because again, if I think of the communication with them is going to, in the long run, pay off with our communication with the doctor. And then that's going to pay off, hopefully, in better care in the long run. You know,
Yeah. I think so.
what would be a red flag for you when you have a patient come in and you have them in the exam room?
In what way do you mean? Because there are several ways that you can.
I was gonna say that's an open-ended
That's very
question.
open-ended.
We could go so many places. We could really get off the rails on this one, Keith.
It
And that would be your
depends.
fault.
It definitely depends because sometimes, like, it depends if you're here for a long time or if this is your first time. It depends on how you usually are and how you are right now. So, like, if I know this person is usually, hey guys, how's it going? Oh yeah, this thing, have to go step on the scale, have to go do this, but joking around, normal, right? And then one day they come in and stone faced or flat, in their tone. Maybe they're short, right? Maybe they're
Mm-hmm.
they seem their blood pressure's higher than normal, sweating. That tells me that's a red flag, but in the way of, okay, something's wrong. Obviously, they're in a lot more pain today. Obviously,
Right.
something has changed.
Right.
Or I mean, it could be in the other way. Oh wow, they seem better. They're talking today, right? But in the ways of red flag, like red flag, um, if sometimes because I'm not as important as the doctor, people feel open enough to tell me things that they probably shouldn't,
Oh,
or
yeah.
like
Like,
like
are they trashing the doctor to you?
sometimes they do
Really?
that, or sometimes or
Don't
sometimes
they know who signs your paycheck?
yeah,
I
or
mean,
I mean, some people don't, because we have an NP as well, a nurse
yeah.
practitioner. Some people are like, I don't want to see her, I want to see him, and it's like, oh,
Yeah.
okay,
I
you
love
know
that.
I feel that.
I get it. You know, when I was in Vegas, my doc had two NPs, and one, oh my gosh, I would go to the ends of the earth for her. The other one,
Yeah.
not so much, right?
Mhm.
Just a personality clashes, right? Um, but Diane at the office I'm at now, another super rock star. She's always been exceedingly polite to me especially when I'm having bad days, you know, and but I can it's like you need to have like a t-shirt that says remember they sign my paychecks,
Yes.
right? And you know,
Yes.
Yeah.
You know?
Don't talk shit about the doctor.
Yes.
please.
Or they sometimes
I can't believe it. I really can.
Yeah.
You know, I can, unfortunately, but
Yeah.
There's plenty of stories, but it's like, okay, now I know where we are
Yeah.
in the mindset of us. Okay, now I know what you're about. Or
right.
it'll be sometimes I've had people say, don't tell Dr. Leek that. Or like
Mm,
in regards to
yeah.
like a high blood pressure, I'm like, okay, why would she not want me to tell him that? And then I find out why, because he's not gonna like how high your blood pressure is.
Right.
Or
Right.
it's I can not do some things. Like, if you don't want me to take your blood pressure because it's gonna hurt your arm too bad, I can just not take it. And I write that down, say, patient denied this, and we can move on. And it's not a big deal, and you can ask for those things. You say, hey, I don't give him a temperature today, or I don't want to step on the scale. I'll
I
be
can
like,
say that.
yes. If you
Keith is like,
I mean,
yeah.
we
No
need it.
shit.
Sometimes we gotta get it. Just you can't do it every time because we want to know
Once in a while.
once in a while. But for the most part, if you're like, hey, I really don't want to step on the scale today, okay, let's go straight to the room. What's
Holy
There's a
or
light bulb that just went off on top of his head.
yeah, usually I'll just ask, hey, well, I mean, if you could give me your most recent weight, and I'll just ask you instead of stepping
I
on the
love
scale.
when they ask me my weight instead of having weighed me. Like, what's your weight? And I'm like, you know what? I'm going to tell you minus
See,
10.
this is worth
What my goal weight is. It's my goal weight.
this is worth the whole time. I just learned I can
Yes.
deny the scale.
Well, it's patient
Yeah.
autonomy.
Or you can lie about your weight.
Patient autonomy. I can't force you to do anything.
Yeah, but that's
true.
just like so awe-inspiring. That is like
He's like, I never thought that.
that's such a cool trick that you have.
Mhm. There's a whole button and everything.
Trick.
The whole button that
There
says, patient said no. And I said, okay.
Really?
Yes. Yes.
Patient did it.
This is probably information you should not have passed on to me. I'm just gonna look.
Yeah, I was like, you shouldn't have said this. You just
you gotta do it
released a
sometimes,
monster.
please.
Wait,
But
on a little bit more serious note, before we got started tonight, because I wanted to go into this too, we mentioned how, as much as myself as a chronic pain patient, I don't like the term med seekers, right? But if I'm going to be 100% honest with myself, I am. Does that make sense?
I think
I mean, technically.
Yeah. I think sometimes there's a connotation, or not, or yeah, like there's a kind of
negative connotation.
Yes. Yeah. But that is what you are. I mean, that's what you're here for. That's what you go to a doctor for.
Right.
I want treatment. I want medication. I want whatever. And I'm coming here and I'm going to either pay you directly or pay you through some insurance. And that's what I'm here for. It is a exchange of goods and services. Like, it is a service. You came here for a reason. And you shouldn't see yourself so down to, you can say, hey, I'm here to be treated. The difference between
I'm here for medication.
Yeah, I'm here for it.
Medication
this is
treatment
what I'm
or
here for.
whatever. Yeah.
Yeah.
I think that's kind of like similar, like, Keith, we've talked about doctor shopping and how that term has been just has the negative connotation and has been used so wrongly.
So hijacked. It's been so hijacked.
Yeah. And I think it's just, that's something similar, like drug seeking. Like, people, if you say you're drug seeking, that automatically is negative. That means a whole bunch of bad things. They now like typecast you as this type of person and all of that. But in reality, it's like, well, we're looking for this medication and we're seeing if you can provide it or not. And if you can't, we're probably going to go in somewhere else. Yeah. So it's like, I understand why people don't like the term, but I mean, in technicality.
Yeah. You're just seeking treatment. You're seeking.
And that treatment just happens to be
a lot of times.
Yeah.
Because I mean, I've beaten it to death. It's where everybody knows I hate taking meds. I hate taking meds. And we talked about that last week. And Amy, you did a post on TikTok about, how the stigma, everybody like our circles thinks that we look forward to our meds, or we look forward to
Yeah.
taking meds. And there's not a single true chronic pain patient I know that wouldn't give them up in a heartbeat if they didn't need them for quality of life.
Yeah.
But so I think we need to do what we can do to not place the stigma of med seeking or treatment seeking on ourselves when we're doing it for the right reason, because nobody wants to take this stuff. Nobody enjoys paying the med tax, where you're in a constant fog, or the other horrendous side effects, of them.
Yeah.
But we also are realistic in knowing that if I want to go try to do my best with my grandkids, or deal with this new dog, or go to Walmart, go to HEB to go grocery shopping,
Right.
I'm going to need something. I'm going to need some kind of assistance along those kind of lines,
Mhm.
I think a lot of times it's difficult. I talked about the other day about when in the mornings, especially, it's very difficult for me because I keep all my meds in one Amazon box, basically, right? And I'll grab them
Classy.
off the shelf, and I'll just start sitting them
Yeah.
out. And it's like 9 times out of 10, I'll look at that going, fuck, I don't want this stuff. Then the mornings for me
Yeah.
are the hardest time to get meds in me. It's because I know I know the tone of the day once I start taking them. I know I'm going to be
Right.
better. I know I'm going to be able to get things accomplished, but I also know the brain fog that comes along with it, right? I know the
Mhm.
limitations that,
Yeah.
that's
The side
that's
effects.
right. That's why
Yeah.
my body is flaring so bad right now. But for me to drive out to the studio tonight, I'd have to take my full dose of what I'm allowed to take, and I can do that, and I can
Yeah.
drive. That's legal. But in the back of
Right.
my head, as a former truck driver with nearly 1 million miles on me, I choose not to,
Oh,
right? Because God forbid
yeah.
there's an accident that I'm involved in, not my fault, but there's fatality. They're going to do a
Right.
subpoena to draw my blood, even though the accident wasn't my
You're
fault.
screwed.
And then it shows a high dose of whatever in my system.
Mhm.
Then I'm going to have to explain that to attorneys and to prosecuting attorneys and to lawsuit attorneys, why that was in my system
Yeah.
and why I was driving, you know.
Mhm.
So
Yeah.
that's why I couldn't make it tonight. Make it out there, and Amy and Evelyn knows, and I'm sure Doc knows because the way I was apologizing, it kills me that I can't keep that commitment to be out there tonight.
Oh, you have
But
no idea. Yeah.
at the same
It does.
time, I can't. So I would give up in a heartbeat. Somebody said
Oh,
that
yeah.
they take Porter says take 15 pills at night, give them up in a heartbeat,
Yeah.
right?
I
And
know. I recently started putting all of my nighttime meds in a pill organizer because I thought this will be easier, because then every single night I'm grabbing this bottle and I'm grabbing all these bottles. It would be so much easier if I just put it in a pill organizer. So I did that. I put it all in pill organizer. And the first night that I did that, I got the little thing and poured it in my hand. And it was just, my
geez,
hand was
overwhelming.
full.
Oh yeah.
And I looked at it and I was like, this isn't any better. Like this, both options really suck. Like, I don't like grabbing 1 million pills, but I also don't like seeing 1 million pills in my hand
No,
to swash it back. And I was like,
it's defeating.
I'm like, at that moment, I was like, who in their right mind would think that we enjoy this? Like,
Anyway,
my thought process is, how do I get rid of some of these pills?
Yeah.
Like,
right.
what needs to happen so I don't need to take this now? That's what I want to work on. Yeah.
Yes. And I
It's
mean,
Right.
I
crazy.
have that experience of taking, I mean, not
Yeah.
quite the same kind of medication, but I mean, I was on a lot of
But medication.
and I'm, pretty young. Still a secret yet. We haven't dropped
Yeah,
that
we
yet,
haven't
the
touched on that
information.
yet.
I was
But,
like, we haven't.
you
I
know,
was like, I
and
forgot about that. We haven't
but it's
shared.
still like this at night, and I remember having school the next day or whatever, or college, secret. You don't. I'm not gonna give you any hints of what I am,
No.
but
We'll get into that very shortly.
and then I have to decide. Well, is it worth me getting a good night's rest and taking my medicine, or should I not take this, be able to wake up on time and feel terrible tomorrow? Is it worth it?
Is it
should
worth that
I
tax?
yeah,
Right?
how early should I take my medicine so I don't sleep in until noon, right?
Yeah.
Or I wake up and
Mhm.
I fall out of bed because of orthostatic
Right.
hypotension, right? And I just,
Right.
pass out.
I
It's
just
Yeah.
it's
I
a
just want
lot.
people to try
It's
not to beat
it's a
themselves
lot.
up for acknowledging the fact that, yeah, we are going to be med seeking. If it can help us, we're going to seek those meds, even though we hate taking them. One
Yeah.
last thing before I get into your age. How, if you could explain to people, how can I put this? Sometimes there's a long wait to see the doctor once we're back in the exam room,
Yes.
right?
Mm.
We don't want to take that out on you, but can you kind of give an insider's take on why that happens sometimes and why maybe we should be a little bit more graceful? Because I fight
Absolutely.
that at times.
Yeah.
Absolutely. And I get it. I feel bad. I'm like, dang, I know they're in there and they've been in there a while. But it's like this. From the time you walk in the door, because you called me the jack of all trades, and I do lots of things, but I am a part of a team, and this clinic is run by
Right.
a team, and I could not run this thing by myself. I mean, you need a group of people behind the scenes to run this. So when you walk in, you have the receptionist, and then you have people checking your insurance or whatever, your payment, as you're
Mm.
just sitting in the waiting room. And then when you get back there, I do your vitals, but then all of that's still running. So we're still working on, maybe you need a prior authorization for your medicine. All of these cogs are moving, and then I talk to you, and then I'm putting your stuff in your chart. And while that's happening, Dr. Leek and whoever is still, right, your doctor, your nurse practitioner, whoever is still seeing all these other people while this is happening. So it's
Mhm.
our job as all these different moving parts to try to do this efficiently enough to where by the time he's done, you're ready to go, right?
Right.
But sometimes, some days are harder than others for people. Some days, some people need more time with the doctor. Sometimes,
Mhm.
something is hung up payment wise,
Mhm.
billing wise. Something's hung up at the front desk, maybe it's a scheduling thing, maybe it's whatever.
Right.
All of those things can stop the conveyor belt. You know what I mean? All of these things can slow something down because if
Mm.
it's stacked in the front, if there's a million people up front talking to the front desk, then some people aren't checked in. There's maybe one or two, and there's like
Mm.
8 people in there. It's hard for me, just one person, to get all those people moving. So then, if Dr. Leek
Mm.
is waiting, but there's all these people up there, it's like it just slows things down. Or it could be the
Right.
opposite way around.
Yeah.
Maybe I have full rooms, and there's still people waiting, and Dr. Leek is working on one patient. He's still only one person, and there's full rooms, 4 rooms full. They all need to talk and get their time in, and any
Mhm.
part of the system will make your experience longer.
Right.
Yeah.
And so it's not always your fault. It's not always the doc's fault or the PA's fault or the receptionist's
Mm-mm.
fault or the billing company's fault or billing department's fault or whatever's
No.
fault.
Well, it is very
it's just
satisfying.
life.
It is very satisfying to always blame insurance. I think
Yeah.
I think
Always.
we can always agree that
Always.
it's okay to bully
The
insurance.
worst.
Yeah.
We can all
Yeah, they're the
I have no
worst.
problem
they
with
can be
that.
the
Yeah.
scapegoat. But yes, it's
Yeah.
not always
Just blame anything on them. Not even like medical related. Just in your
Yeah.
life, if you need someone to blame
insurance.
insurance.
Yeah.
Yeah.
Before we
Yes.
get into
Absolutely.
one really cool thing about you, which will include your age, did we leave anything out of this discussion tonight that you wanted to get across?
I think really it's just I don't think we really talked as much about how I don't know if we're getting into that, but I am an invisible, and I've been with Dr. Leek on live, kind of in and out, and I'll monitor the chat, and I'll watch Keith talk, and he's like, let's do the victories of the week,
Mhm.
right? And I'll be like,
We're
that's
getting to those. We'll get to
I
those.
had some, and it's hard
Yeah.
because sometimes I've wanted to be like, hey, that's me too, You know,
Oh,
because
you
I
should.
am
You're welcome.
one of the group. I have
Yeah.
PTSD and major depressive disorder, and I have an anxiety disorder, and I'm probably on the spectrum. So,
Yeah.
but you know,
Yeah.
all the things.
So many of us.
So, you know, I every day is a struggle. Every day is a choice, and it's not quite the
Yeah.
same as you know everybody else. But you know,
Yeah.
I understand that's why I could talk about spoon theory the other day,
Mhm.
because that is my
Mm.
life. Every day I wake up, I have a certain amount of spoons. And every time I
Yeah.
need to talk to somebody, every time I need to do, you know, take care of something on the phone, and anytime I need to go drive somewhere, you know, go do something on my own, take spoons from me. And
Mhm.
Mhm.
by the end of the day, I'm in the negatives all the time,
Mm.
Yeah, every
Yeah.
day.
every day.
And
Maybe one week we could have you on and you could share like your story and share about your diagnoses and kind of how it's affected you. That
Yeah.
would be
that
fun.
would be
Would you
cool.
be interested in that? We could maybe have you on another time to share just about that.
Yeah.
Yeah,
Yeah,
absolutely.
I think it's
I
good.
love that.
And
That'd
because
be really fun.
we've proven time and time and time again that chronic people dealing with mental health can learn from people dealing with chronic pain and vice versa. And chronic illness, we all learn from each other.
Mhm.
It's
We don't
mental
have to have
health.
the same,
Yeah,
you know.
it's
Yeah.
definitely a chronic, you know, I will be sad forever. It's written on paper, you know? And
Yeah.
we're both in this forever, guys. So we're all
Yeah,
in this together.
Yeah.
We're
right.
all going to
We
be
are.
suffering for the rest of our lives.
Absolutely. Yeah.
Unfortunately, our diagnosis is different, but we fight the same issues.
Yes.
And the worst part is
We
the
do.
whole, you know, ride and die people.
Yeah.
All right, so I'm going to ask you real quick,
Mhm.
and I want a quick answer,
Mhm.
and then I want to talk about your future plans real quick, because I want
Yes.
you guys to understand the type of person that Evelyn actually is. So, after listening to Evelyn talk tonight, Evelyn, how old are you?
I don't know. Should we have the audience guess?
Okay.
Oh yeah,
If you want to guess.
we could do that. If you want to guess, somebody
Yeah.
take a
I
few
think we should have
guesses.
the audience guess. Take
And
some guesses on
while we're
how you won't offend her. I don't think.
No,
Will they
I don't
offend
no
you?
offense.
No.
No,
They
no.
won't
so
offend her.
type an age in there if you would, y'all.
Yeah.
Um,
Anybody who
Buck
knows
says
me,
20.
don't tell the truth. Don't tell the truth.
Judy says 18. Michael says 21. So we got 18, 20, 21, 25,
24.
23, you know,
Oh,
25.
32,
32.
21,
24 was up there. 25, 21. Man, I
23.
think we got every age covered.
32.
Yeah.
Oh wow.
Yeah.
Hey now, I'm older than that. Don't say that's
Yeah.
old.
Moonchild, how old do you think Evie is? That's the question. How old do we
The
think
question is, how old
Evelyn
do you think
is?
she is?
Because I think once we get into your future plans, it's going to freak people. It's going to really drive a lot of this home. So
I mean, those are some pretty good guesses, guys.
they are some good guesses.
I would have had a lot of those guesses
You know,
too.
So would I.
I know. I always
I
guess
was way
younger than I
off.
actually think because I
What did
never
you
want to
think,
offend
Keith?
somebody.
What did you think?
25, 26.
What? Really?
Yeah. Yeah.
Wow.
Like, what?
That's
Yeah.
insane.
How dare you?
No,
Yeah.
no. I'm just hoping like that'll stand up. Will that stand up in court? Can I go to the, can I
You
go to
go to
the
liquor
bar?
store.
Yeah. Can I?
Exactly. I doubt it. You don't.
Those
Yeah.
are good guesses. You guys are close.
Sarah says 35. Don't tell the judge that Keith said that you were like 25. That won't help your case. Trust me.
35.
So
So funny.
how old are you, Miss Evelyn?
I am 19.
19.
I am
Everybody's
19.
shocked faces.
Yes.
I've
Everybody is shocked.
been 19 for 4 months.
So
I've been
like
19
19
for 4
and a
months.
half?
Yeah.
You're a baby 19.
I'm a baby
19.
And you've been through
Yes,
so much that you're where you are maturity wise and everything like that. That's just
Michael said it perfectly. She handles herself very maturely.
That's
I
it.
agree.
You
That's
know,
it. She does.
I hate that you've
Very
probably had some
wise.
life experiences that have gotten you to this maturity level at the age of 19, but it's very impressive how you handle and you carry
Very
yourself
impressive.
at the age of 19 to deal with all of us crazy chronic pain patients,
Yeah.
you know.
Yeah.
But your future goal is to become a
There's several little. I want to work in end of life care, end of life things. I haven't fully, nailed it down to
That's
one, but my
Mhm.
dream is to be a coroner or, a medical examiner, or if I don't go into medical school, a mortician.
no way.
And then we talked before the live, and
That's cool.
hospice care was brought up, and honestly, I've been thinking about it, and maybe that's something I might look into.
If you
But
want to talk to somebody about hospice, I have somebody that's really cool that you can talk to that
yes,
will talk you into
That's
it more
really
than likely
cool.
because they're a big fan of it. I think what's cool
All interesting.
is it's not necessarily like it's not like the morbidity factor. It's the fact it's the end of life stuff, right?
yes.
And the transition period and the whole family unit type of stuff. I think you'd be a great death doula. I think you'd be an incredible death doula.
Oh
You would
my
just
gosh.
you would
Yes.
just be doing so much for families with that type of situation. Um,
Yeah.
but I think that's really cool
Amazing.
how you're dealing with us now, and helping us get the best we can get, right?
Mhm.
Because you truly care about the patients that come through there, right? But your end goal is to see us from where we are today to helping with with transitions like that.
Yes.
I think
Mhm.
that takes an incredible skill and an incredible touch.
Yeah.
And I think that
Yeah.
says so
Takes a special
much,
person. Yeah.
it does.
Well,
I think,
Mhm.
death has been such a crucial part of my life, especially as at least my young adult life. And
Mm.
I don't think I would be where I am today in any form. I mean, in the way I hold myself and how I see the world, and where I am job wise. I don't think I would ever be where I am if I didn't lose some of the people I lost.
mhm,
Yeah.
Unfortunately, that's just kind of how the world works. But
yeah,
Mm.
something the thing that's always bothered me, even when I was a younger, when I was probably 10, 11, 12, um you know every time death is brought up, we celebrate babies all the time, right? You're pregnant, awesome, oh my gosh. The whole process is,
Mm.
let's get you cake, let's get you all the diapers, let's get you all the little clothes, let's have the balloon explode with the confetti inside and have the dog, backflip into a pool that's going to turn blue, right? We have that, and everybody's so excited for the beginning, but there's something so sad at the end. Life,
Yeah.
life is not just it's you are a baby, and then you adult, and then you are a baby again, and I think people don't realize that. And
Yeah.
I think the way I said it when I was thinking about it before, or in my head before I started the live, because I was thinking about how I'm gonna say this, is you know God, I lost it. um,
go ahead.
No.
um,
I hate when that happens. It's
um,
right there.
y- you are tainted by the sins of adulthood, and
Mm.
we see it all the time. I mean, go to any nursing home, go to any memory care facility. I mean,
Yeah.
there is something else. Even see caretakers with who the people they take care of. There is such a fatigue around having to care for someone, and it's easy to kind of bypass that as a parent or as a grandparent, taking care of a child, because they can't control that they're here, right? They
Mhm,
don't they haven't committed those sins we see, in
Mhm.
in our eyes, as you're a child, you're innocent. But as you lose that innocence, and you're in that second baby stage, well, it's like, well, this is a whole adult, and
Mhm.
this is a person who did all of these things. They worked and they took care of themselves, and they had their own children. Like, there's this level of, you have lost that ability to kind of push through that fatigue of taking care of this person,
Yeah.
even if
right.
you love them to
Yeah.
death, you know and
Mhm.
I see it. I
Yeah.
mean, I've seen it before, even just shadowing Dr. Leek and, when I rounded working towards my certification, all the time, I see, daughters, sons, frustrated, upset with
Mhm.
their parent, and they can't move, they can't walk, they can't get up, they can't do their own things.
Mhm.
Sometimes they're in the nursing home and, the last person they talk to is and the last person they talk to other than themselves is the people who take care of them at the facility, and they haven't seen their children or their spouse and God knows how long. And it's very
Right.
Yeah.
easy when you lose someone you love as an adult to focus on, well, where's everything going? Where's the money going? Where's the property going? Why is she being buried in a casket and not put in an urn? And, I earned this as your daughter, and I earned this as your son. And, you have people come out of woodworks to get money. You have, things that
Mhm.
Oh yeah.
they will not be here to care about in a little while.
Mhm. Right.
We are so focused on what's tangible when the end of life is supposed to be a celebration just like the beginning. And,
Yeah.
Yeah.
there's something so deeply moving to me about being the last person to touch, someone's loved ones, to put them in the ground, to prepare them to be seen one more time, to, be the
That's
last
beautiful.
face that sees their face. And, because once it's over, it's over. And
Mhm.
once,
It would be extremely
Yeah.
powerful to be
That's amazing.
the last person to let somebody know they're loved
yes.
and they're cared
Mhm.
for.
Yeah.
And I totally
And so
understand.
many people don't want that job, I think so many it's needed in that line of work. Like, you are needed. You are called to do that.
As
I'm
much
like,
as I
after just hearing you talk about that, like, that is your calling. That's where you're meant to be, because what you said is just so true, and people need that.
want you to
That's
stay in the
awesome.
medical field and to help people, take over Dr. Leek's practice at some point. I
Oh my
think
God,
you
I
would
don't know
be
if I have the power for that. I
so
don't.
much, so much better at the end of life stage. I think you
Yeah.
have that touch. I see that in you,
Very, yeah.
and it's so rare.
Absolutely.
Yes.
It's so rare. All right.
Yeah.
Before
That's
we
awesome.
jump out of here, let's do something a little bit happier. We still have a few people left in the room, so let's do this. Amy, would you like to introduce the best part of the night?
Yes, the best part of the night is victories. This is the time where we get to celebrate each and every one of you. We want to encourage the small victories of the day and the big victories, because some days we don't really feel like we have any victories and we are flaring and we feel down. And we want to remind you guys that there are victories every day. So
Mhm.
if your victory was just getting out of bed, or just coming to this live and coming and hanging out with us and disassociating for a little bit, or if you had a good doctor's appointment, or you found your unicorn, whatever your victory was, we want to encourage you and celebrate you. So if you would please put your victories in the comments, and we're going to
Yes.
call them out and celebrate it, whether it's been a victory today or this past week. Stick them in there. I want to see them.
Even if it was last month and you had or 2 years ago, I don't care. I need victories, y'all, because
Celebrate it.
I'm running low. I know somebody very close to me that's had some really fantastic victories, but at the same time, my victory bucket is freaking empty.
He's going to steal some of yours.
Tasha, I made it to work and then to hand out water and snacks. It's got to be freaking hotter than Hades out there right now, Tasha.
Oh
y'all,
my gosh.
Tasha works with
In
homeless
Vegas, right?
on the side out in Las Vegas. Yeah.
Yeah.
Judy
Ooh.
went to firearms class again, practiced shooting from my chair, and did pretty good.
That's
Y'all,
amazing.
I'm just going to say, if you happen to be in
Don't
Ohio
mess with
and
Judy.
you realize that there's a lady named Judy in the room, be well behaved.
Don't mess
That's
with
all I'm going to
Judy.
say.
Don't mess with her.
Valerie said after a year, finally getting tapered off prednisone, been on like 30 milligrams
Hallelujah.
of prednisone a day for a year.
That stinks.
Let's see.
You guys are awesome.
Talking to Keith and getting help today was my victory. Thanks, Keith. Well, thank you. Kate did my
Good listener.
biannual EMS talk on EDS and Friends. They apparently liked it. They did, and I'm sure they appreciate. She also
That's
baked for them.
awesome.
She made them like homemade bread and cookies and stuff like that. So
You're buttering it
that's
up. Of course
awesome.
they liked it.
Uh,
I'm sure you did great. You always do.
This is awesome. Porter says, I'm on a new med that is actually working for my Crohn's. Hallelujah. That is awesome.
Woo!
I'm so
That's a
happy
huge
for
victory.
you. Bobby said, I made myself chicken dinner with gravy and sweet potato as well. Dang it. Koa.
That sounds good.
Koa, look at this. This is talking about overachievers. Koa did an everything shower twice this week. That's bragging almost right there. I wish I could say the same thing about that.
Everything shower. You fancy.
That's I
real fancy.
Yeah, I'm not gonna go bad how bad mine is. Let's see what else.
It's summer. I gotta start shaving the legs again. It's a problem.
Somebody made an omelet. Who made the omelet? Beamy. You deliver. I love omelets. I guess it is a Porter's med for the new med is pretty good. Better than the old one. They said last med tried to kill him. So yeah, that's an improvement.
Yeah.
That is a true improvement. That is
awesome.
Very
big improvement.
Moonchild said
are killing it.
Steak tips, broccoli and rice peel off for supper. God, you guys. I'm gonna have ramen again tonight. Jennifer got 3/4 of the Jennifer's got 3/4 of the garden done, then got 7 more plants. That's too funny.
Oh my gosh.
Jamie spent yesterday advocating for my mom and today in the ER advocating for your partner. I bet you're pretty vicious. I bet you are pretty vicious advocating. I couldn't.
Proud of you.
You're somebody I want on my side. So
yeah. Absolutely.
On that note, Cynthia said I was able to travel for medical tests yesterday versus having to cancel as prior. I don't know about the canceling stuff. Let me tell you.
Yeah, I was like, I've done that already this week. That's awesome.
So, Miss Evelyn, you survived.
Yes.
See, we told you would survive. And we told you people wanted to hear what you had to say, right?
Yeah.
Because you're invisible. We want to always hear what people who are other invisibles have to say, because invisibles' ideas and messages are important to us. Do you have anything on your list of notes and stuff that we left off tonight that you definitely want to get out?
No, I think everything is okay. Yeah,
covered it.
Good.
Awesome.
Miss Amy, do you have any parting words?
Thank you guys for being here as always. Thank you guys for hanging with us through the technical difficulties tonight. Thank you guys for giving us grace with all of that. We appreciate it. And thank you guys just for being here. You guys are an amazing community, and being here and supporting Miss Evelyn, coming on and sharing part of her story. And we're excited to hopefully have her back to share more of her story.
Definitely.
But thank you guys for being so kind to her as well. I hope everybody has a good rest of the week, and I'll see you guys later.
See you later. I just want to say thank you again, Evelyn, for coming on tonight and for giving your time and your opinion and your ideas on how we can be better, how we can hopefully show more grace to the medical assistants that are helping us. Thank you for the tip that I don't have to be weighed every time I go into the office. Thank you for
just unleashed a monster.
Yeah, thank you for giving us the point of view of our care team that I don't think it gets enough light shown on it, and for helping us to maybe go in a little bit less apprehensive when we go to our appointments to see our docs. And hopefully we are encouraging people to be more open and honest with our medical assistants, knowing that in the end, that's going to pay off so that we get better care. So your time tonight was invaluable, and we appreciate it. I want to say thank you to Kevin back in the studio for putting up with us and for doing everything he could to make this happen tonight. I don't know what's going on with YouTube, but we'll figure it out. If it's anything to do with invisible, you know, someone's going to get jacked. It's just, if I'm attached to it, it's something's going to get jacked. And well, it definitely did tonight. If you need me, email is the very best way to reach me, keithcpp@gmail.com, or find Amy, or find Jennifer, or find Kate, and they will track me down. I am taking the next 3 days off, not because I don't love you guys, but because my mental capacity is shot right now. Not because I don't love you. I am just going to be doing that. So Amy will be my contact, or Jennifer or Kate if it's an emergency. or email me, whatever you need to do. I want to say thank you again to Evelyn and to Amy and to Kevin back in the studio. I love you guys. Kevin, we're going to close off of YouTube, and then I will do a separate close off of what is it? TikTok. That's what it is. Thank you again, Kevin. You have a great night. I'm hitting the leave button on that one, and then peace to YouTube or to the Zoom channel.
Peace to something.